Degenerative disc disease, that's what we're dealing with today. And this is a situation where it causes pain. There's not a great surgery in many cases to take care of it because traditionally the treatment has been spinal fusion. That's rods, screws, big surgery, big recovery. Young people don't need that sort of surgery, and the results are fair in most cases. This surgery is different. This is for people who have vertebrogenic pain, so pain that is a result of the discs being damaged, swelling, inflammation in the disc, and that's what causes the pain. This procedure is about 60 to 80% effective, and it lasts for a number of years, up to 5 years. It's a relatively recent surgery. It's high tech. It's great. So this is what we're going to do for this young patient at L3 and 4 through 2 small incisions about 1/8 of an inch or less. I'm going to put an electrode into the bone and basically destroy the nerve fibers that receive the pain. And that's what the success is based on, is it will take care of the pain in this patient. They can go on without spinal fusion, without a major surgical procedure. So let's go. Image. There you go. There it is. So this is going to be the L3 level, the L4 level, and starting point is going to be here, slightly lateral to that. Small incision to do the procedure at that level. Spending a little time up front just to get the x-rays optimum will then make the rest of the procedure sort of a one-step procedure. This is the nerve right here, kind of hot white spot. So that's exactly where this procedure is focused, to destroy that nerve so that he doesn't feel the pain related to all of that swelling. So now a little local, which also helps with bleeding afterwards, but helps with pain after the surgery. This will last 4 to 6 hours, just numbing up the whole path where I'm working and then the skin. Incision. So use a small incision, about the width of the knife blade here is all that it takes. And then gently tap this into the bone. And now I take a special memory metal channeling tool, which then will help to get that towards the center. So I only need to make one poke hole. On the AP image, centered perfectly on the spinous process. So that's where I want to be with this. And this is what heats up inside the bone and actually destroys the nerve, so that then the patient doesn't feel the pain anymore. And that's centered right on the spinous process and lateral, right in the exact spot. I couldn't ask for it to be any better. I'm retracting an insulating sleeve that then will allow my probe complete access to the basovertebral nerve, and we're ready to go. So that's the L3 level. I'll do the exact same at L4 now. Perfect. All right, skin knife. So you'll be able to see a little bit better the incision where I've numbed it up. So now we're right at the medial pedicle border and right in the center of the vertebral body. Again, the channeling tool goes in. I think that's a nice position. I think that'll give us a good RF burn. So now it's just a matter of waiting until this level is complete. Then we'll pull this out and repeat on the right side. So this bone really shows that there are probably microfractures in that end plate. And when you get microfractures and swelling, that's when you get ingrowth of the pain nerve fibers, and that's classic vertebrogenic pain. Place this probe in, make sure it's perfectly centered, and it is. So now turning this will retrieve the insulation back, so now our probe is completely uninsulated so that it is effective. Draw this back until it gets to that white line. Perfect, and we're ready to go. And then while we're doing the burn on that side now, I'll inject my PRP. So here's the PRP, which was drawn from the patient before surgery. It can aid in easing some inflammation and pain after the procedure. And that's all there is to it. That is an L3-4 Intracept. I would expect this patient, especially with that MRI scan, to see some pretty substantial relief without a major surgery. So I think this is going to be a success.